Started your 2 minutes time.
Next page, ma'am. Any other page? This is the last page, ma'am. First page, ma'am. Next page, ma'am.
Hello.
Ma'am.
Yeah, started.
Hi, I'm Dr. Muthulakshmi, one of the doctors in the antenatal clinic today. How may I call you?
Baljit is okay, doctor.
May I confirm your age, please?
28-year-old.
So, Baljit, so I can gather from your GP letter that you're 36 weeks pregnant and you're here to discuss about the delivery options. Am I right?
Oh, yeah, doctor.
Since we are meeting for the first time, shall I ask few more questions to know more about you better? Then we'll plan the safe and mutually agreeable plan of management.
Okay.
So, could you please tell more about the current pregnancy?
Doctor, I'm 36 weeks into my current pregnancy.
Okay.
So far as my baby, my blood test, everything is normal. And I'm just worried. I'm just worried about the previous episode, what had happened with me, that is shoulder dystocia my baby had. So I want to avoid it.
So, your concerns are valid. We as a team are here to help you. Don't worry. Okay.
Thank you, doctor.
So, is your baby moving well inside?
Yeah,
So, are you taking pregnancy supplements?
yeah.
Okay. And are you aware of the last scan report? When was it done?
Yeah, it was done 2 week back, doctor, and the baby is around 2.8 kg. Everything is normal.
Right. So, could you please tell more about your first pregnancy?
Oh yeah, doctor, it was actually a planned pregnancy. This is also planned pregnancy. That was I was diagnosed as a case of diabetes during pregnancy, what is known as gestational diabetes, something like that. But it was controlled, and then at 2 weeks prior to my due date, I went into labor. The baby was a little bit big at that time, and I Although the labor was very quick,
Mm.
but at full dilatation I pushed for almost 2 hours, and then they decided to put some instrument, but I was not very keen. I pushed my baby, and my baby's shoulder got stuck actually. It was very horrible experience because everybody ran away, ran in. They started shouting. There were noises, and then the baby got delivered. Luckily, the baby was fine, but I had some tear into my vagina, which were sutured. It was painful for some more time. That's it, and I
Yeah,
don't want to
so,
have it. Yeah, I don't want to have it again after this time.
yes, I can acknowledge it must have been a difficult time for you. So, have you been connected to counselors and someone debriefed about the condition after your delivery?
Yeah, told me about shoulder dystocia. Yeah, they mentioned about that.
And how was the baby doing now?
The baby is fine.
And how was your recovery after the
Yeah, it was
days?
fine, doctor. But that those means buzzers, those people, it had impact little bit on my mind. Now I am very fine.
So, I think if your mind is still disturbed, I can offer you
No,
counselor.
no, it's okay, doctor. I have come out of that.
And shall I check your notes with your permission?
Yeah,
And are you having any incontinence to gas?
no, no,
No,
no. It was not
nothing.
deep tear.
Hmm. And are you having any other medical concerns
No,
and any medicines other than the pregnancy supplements?
no,
Any allergic to medications you're having?
no.
And any family history of concern like sugars in your family?
No sugar, but I had sugars last time.
Okay, okay, so you mentioned. And you are a nursing assistant, right?
Yeah.
So how is your work going?
Yeah, it's okay, doctor. I'm
Otherwise, how
enjoying.
is your okay, fine. How is your support at your home?
Yeah, it's all, everything is fine, doctor.
So coming to your options, so you're here to delivery options. So someone explained about the options before you have any preferences?
I don't want to have it again, doctor, because it was really frightening. So I just wanted to discuss what means how you are going to manage me this time. Can you prevent it or predict it?
Yes.
And what are my chances of having it again?
Yes. So yes, the concerns are at most valid. So in generally shoulder dystocia like cannot be prevented or predicted, but in women who had this condition before, like there is tenfold increased risk. So we can make arrangements before to handle the situation well. Am I
Okay.
clear so far?
Okay.
Okay.
That means
And
there is a very high chances that it might happen again.
so the chances are there, Baljeet, but again, it depends on the many factors like your baby weight, how the labor progresses this time.
Okay.
So, but your wishes will be respected. So, in general, women who had this condition before, if there is no permanent injury to the baby and there is no like permanent disturbances in the water work or a bowel, so as per the evidence, if the baby weight is less than 4.5 kg, so we can go ahead with the vaginal delivery.
Okay.
And if there are any concerns, and we can plan for a cesarean section. But again, this will be discussed by a team of doctors like my consultant, baby doctor, and anesthesia doctor, and the counselor. And of course, your wishes will be respected.
Okay.
So we may offer you another scan at 38 weeks to check their baby's weight, after birth position, and also the assess the neck of the womb, how far it is softened. So then we can plan your delivery plan. Am I clear so far?
Yeah, doctor.
And in case if you are going for a vaginal delivery, so it will be in a consultant led care unit with a team of doctors all around, and one-to-one care will be given, and we'll monitor your labor in a special chart called portogram, and we'll give a pain relief. And if there are any concerns, we may decide for a cesarean section early.
Okay. And
And yeah.
if at all I decided to go for straight cesarean section, doctor?
So, of course, your wishes will be respected, but in cesarean section, it reduces the risk of like shoulder getting struck and the birth injuries to the vagina. But it has increased complications of surgery and anesthesia, like injury to the nearby structures, bleeding, infection, clot formation, and also it increases future cesarean sections.
Okay. Okay.
And also, Balti, this my time will take utmost precautions during your delivery time. We'll make a consultant, baby doctor, and senior midwife will be available to handle the situation. And we'll give special medicines after the delivery to contract your womb. And this time, we may consider a cut called an episiotomy prophylactically to reduce the incidence of the tear. Again, it will be decided at the time by my consultant. Any concerns, Baljit?
No, doctor. I'm okay with that. Actually, it is just worrying me. I would means what I should go for because I would like to have more babies also.
Yes, you can take your time and you can discuss with your partner. I'll also give a written information leaflet about this previous shoulder dystocia, and I'll book an appointment with my consultant next appointment. And I can also connect to the counselors and support groups where they will share about their real experiences. So you'll be in a better position to choose it.
Okay, doctor.
And
Thank you.
I'll write back to your GP, and I'll also document about your care plan in your notes.
Okay. Thank you, doctor.
Thank you.
Well within time.
Yes.
30 seconds. What you missed? Missed out on one or two things.
Uh, Shoulder dystocia implications, no?
Yes. What are maternal implication? What are fetal implication? Whatever
Yes.
condition you are having, yeah, it's always better that you will explain the implication. Okay. Like checking background knowledge, the similar way implication you have to tell. Okay. Information gathering. The previous history of GDM. What are her current sugars? I didn't tell you. Hello.
Ma'am, you told everything is blood test normal, so I thought I didn't ask further to ask the answer.
Blood test. See, I
Okay.
will not. See, every
Okay, ma'am.
routine blood test are normal.
Okay, ma'am. Okay.
But yeah, you didn't ask me. Okay, you
Yeah, I
assume that
didn't ask,
everything
ma'am. Yeah, yes,
here.
yes.
But what will happen? Dating scan, everything is not playing any major role. Blood sugar, unless and until you will not had they offered you blood sugar, unless and
Okay.
until you will not ask role examiner will not score it that you are aware that she had previous GDM. So whether she needs to undergo this blood test or not. So you have to ask here this particular test.
Okay, ma'am.
Okay. So this particular test you need to ask. I'm not saying that double marker, blood group, and all
Yeah,
those
okay.
things. Okay, you got my point.
Yes,
That
ma'am.
was missed out. Arranging us another scan by 38 weeks, and at that time we will be deciding if there will be baby will be big. Then we will be deciding how to go ahead with the labor. Induction of labor is another question what I had, but then I skipped it. So, uh, anybody wants to comment on her performance? Manika ma'am.
Ma'am, induction of labor can be done only in presence of GDM or diabetes, ma'am.
Yeah, it
And
is generally actually accept. It
yeah.
is only done in that cases. In the
Mm.
answer key, they had mentioned that not means the answer key was little confusing. Induction of labor not means if the baby is little means going towards LGA. If we are really worried about that, otherwise induction of labor will increases the risk of shoulder dystocia. More
Mm.
spontaneously she goes in labor, the chances of delivering her normally will be more. Okay, so
In
induction
the
of
in the guideline, it is mentioned it reduces only the shoulder dystocia in a diabetic,
yeah, it
not in
reduces not in
after
other
38.
patients. Yeah, not
Yeah.
in other babies, not in other patients. Okay, so here, as of now, the only risk factor what she's having is her previous shoulder dystocia. No other risk factor is there, so we can very safely allow her to go in spontaneous labor. Watch, be vigilant. Any intervention, any abnormality, we will be a little. We will take her little early for cesarean section to prevent that, and the expertise will be available to tackle the shoulder dystocia in a same manner what had happened last time, so that the favorable outcome will be of possible. Okay, because even in shoulder dystocia we have to say most of the time the baby and the maternal outcome is good. It is only at few instances or few times the outcome will not be what we had expected, okay, or it is not good at outcome. So overall those 2 3 points only you missed out. Other apart from that, you asked, you were able to complete the task well within time. Okay, so here also introduction, situational awareness, midwife called to see patient who is referred by GP. Okay, uh, aim of the consultation is discuss mode of delivery, that is post shoulder dystocia. Shoulder dystocia. Uh, Multiple concerns, will it happen again, how to prevent, setting agenda, ask questions. So open question, details about anyway, previous pregnancy, current pregnancy. So here my first question is details about previous pregnancy, labor, delivery, explain, acknowledge the difficulty. If she says yes, few women experience this kind of complications, sometimes it is terrible. So do you have any flashbacks, do you have any nightmares of the same event? If you so, I can offer you counselor, you had offered me that is okay. Outcome of the baby, outcome of the mother, you asked me that history also. So risk factor, you have to ask now the risk factor history. BMI you skipped.
Yes, no, I
What is
forgot. BMI and blood group. Yes.
blood group is okay, but BMI. So you need
Yes.
to ask the risk factor, okay? And previous operative vaginal delivery, no, it was not. It was they were attempting, but baby
Yeah.
delivered. And then gestational diabetes mellitus, that was another risk factor. Okay, debrief, traumatized, flashback. So you asked everything. Yeah, they debrief, but I would like to, you can also start with shoulder dystocia explanation. Current pregnancy, planned, unplanned, booking blood test, last USG and EBW. Okay, so last USG was 2 weeks back, a couple of weeks back. And in this case also sugars you have to ask, okay?
Yes.
Booking blood test, even I had asked, somewhere mentioned account. Acknowledge her bad experience. Although shoulder dystocia is associated with risk factor, it cannot be predicted and it cannot be preventable. It is not means we cannot predict or we cannot prevent. But many a times we come across this condition as an obstetric emergency. This sentence you have to mention. Somewhere you have to mention that it's an obstetric emergency. Somewhere somehow you can ask. And expert team and persons needed to tackle it effectively, and we were able to handle it effectively last time. The team was able to handle it last time. Okay, did debrief, counseling post delivery, yes. Mental history you can you asked, okay. Emotional vulnerability, any medical history, especially diabetes, surgery, allergy, smoking, alcohol, access case details you had mentioned, what she knew about shoulder dystocia, check her knowledge and explain her about shoulder dystocia. It's an obstetric emergency, you can start from here also. It's an obstetric emergency where the baby's head get delivered and shoulder get stuck, sometimes one, sometimes both. And there will be delay in birth of the baby's body. If this happen, we need extra help within a short span of time, and that's the reason we there will be miss she might be saying no, there will be there's noises, running people, all those things. So that is an emergency, and that's the reason we need to deliver the baby as early as possible. And that's the reason we have to deliver this baby. We need to press the buzzer and call people inside as early as possible. And that's why they were running, there were chaos. So that's why. Okay, what are the implication? Maternal implication is maternal pph and tier 2 back passage or vagina. Fetal, difficult delivery, fracture, arm, fracture of the arms, bones of the arm. Then sometimes there might be less oxygen supply. Baby might need an ICU admission for some time. In severe cases, wherever there are very severe, serious complications like brain damage due to lack of oxygen supply for a prolonged time may happen. Okay, so here we are just giving her whatever can happen, which is very rare. But these are the complications which do happen during this shoulder dystocia management delivery. Okay, chances of happening is 1 in 150. Risk factor is large baby, obesity, or operative vaginal delivery, prolonged labor. Previous shoulder dystocia increases tenfold risk of having shoulder dystocia. So in her case, her risk is tenfold. Now that is not preventable, not predictable. So what next measures? Yes, so her labor will be in consultant led care unit, and again we are going to assess the risk factor. What are the baby's weight at 38 to 39 weeks of gestation, whether there are any other risk factor, and we will discuss the we will plan then the we will plan whether we can offer early delivery by kick starting or planned cesarean at 39 weeks of gestation. Okay, so at 39 weeks, if she opts for vaginal delivery, then yes, the pros of vaginal delivery will be, if it is successful, the chances of having a complication is very less, early discharge, early bonding, and it is a more natural way of delivering a baby. But yes, it carries a risk of shoulder dystocia in 10-fold cases, and we need to tackle it very vigilantly, vigilantly. Emergency, it's an emergency situation. Vigilant monitoring, a presence of skilled personnel to be present at the time of delivery, and any deviation from all these things, early intervention by skilled personnel, early cesarean section. So we have to take actions very vigilantly as early as possible, including we have to be open for cesarean section if any deviation occurs. Another precautions, we will be citing IV line, booking blood and blood products, and informing theater and anesthetist also. The theater team and anesthetist will also be informed for this patient. Consultant will also be informed. Okay, the person who will be there, will be skilled to deliver shoulder dystocia. That doesn't mean the consultant needs to be there. A person can be even ST6, ST7, or ST5 who has already skilled in delivering this baby. Okay, to avoid this completely, one do opt for cesarean section, which is safe for baby. Very nicely you mentioned that that is a safe for baby, but yes, it carries the risk of anesthesia, surgery, bleeding, infection. Future pregnancy needs repeat cesarean section. Placenta might be adherent, delay in discharge, delay with bonding. Sometimes stitches might be painful for some more time. Cut on baby's head, scalp, and childhood asthma or obesity, who the baby for the babies who are born with this cesarean section. So these are the risks associated with cesarean section. But yes, we you can choose cesarean section, as it completely eliminates the risk of shoulder dystocia. But the currently the evidence what's saying, the babies who are born without having any abnormality, and the mother who are born who had not had any third degree or any back passage, extensive back passage tear, they can safely offer vaginal delivery with vigilance and skilled personnel in the labor room. Okay, in the labor room. So these are the recommended guidelines what they're saying. But yes, we will be again assessing the baby's weight, and at that time we can again redecide, okay, reconsider what suits you better, whether to go ahead with the vaginal delivery or cesarean section. Vaginal delivery will always be having a upper hand, because spontaneous labor do have very good chances of having uh, no, not said. This is not a right sentence. The right sentence here is if the patient goes in spontaneous labor, then there is very good chances of having a good outcome. Okay, good outcome if no other risk factor and less complications. So we have to counselor little, means it will be a bidirectional counselor. We are not forcing her to choose vaginal delivery, but we are here explaining her pros and cons of both the options. And somewhere we are just saying that vaginal delivery, although there are the chances of having repeat shoulder dystocia, but that will be an option in her case because it is having a less complications if it will be successful. So you can document her care plan, follow up with USG after 38 weeks with consultant, and if no other concerns can be offered can be offered vaginal delivery, which, and if there is any concerns, then consultant might discuss option of cesarean section in her next appointment. Okay, so this is my ending sentences. If no other concern can be offered vaginal delivery, if there is any concern, then the consultant might discuss the option of cesarean section in her next appointment. So I can offer her patient information leaflet about shoulder dystocia at the same time cesarean section, because she also would like to know about cesarean section. If she wanted to know about induction of labor, we can offer her induction of labor also, and counselor if it is bothering her. Okay, so if anything goes wrong, we will inform this risk management team, and we can end the task here. So now coming to the domain wise scoring, information gathering is previous history of GDM, shoulder dystocia, maternal and fetal outcome, previous labor detail, BMI. Uh, Current pregnancy, sugar and ultrasonography. Okay, you have to ask about sugar and ultrasonography. Review medical records, you mentioned. A certain fear and anxieties, you asked. Here, the discuss the pros and cons of vaginal delivery. Risk of recurrence will be tenfold. She needs to be delivered under consultant led care unit. Fetal scan again at 38 weeks of gestation. Encourage questions. Deliver information in varied quantities, gauging through understanding of at each stage. Risk versus benefit of vaginal versus cesarean section. Applied clinical knowledge evidence that induction of labor will reduce the risk of shoulder dystocia, except in diabetes and GDM, which is actually been given in the book Konje, but this is not a right sentence. Okay, discuss the recurrence risk, pros and cons of vaginal versus cesarean delivery. Risk factor, how one can predict recurrence. Okay, what are the recurrence risk factor? We need to mention at least two or three risk factor you have to enumerate. So what are the risk factor in general? Elective cesarean should be considered to prevent recurrence and reduce morbidity. Nice guideline, RCG guideline to inform decision making in management of patient with shoulder dystocia. Patient safety here actually offer emotional support. Seem to have traumatic experience, psychological support which you had offered. Give me an information to make a informed choice. Choosing an elective cesarean section is recognized approach to managing women with previous shoulder dystocia, which will be offered at 39 weeks of gestation. Induction of labor is an option to reduce recurrent shoulder dystocia. I don't think so. It is an option in routine cases. It is an option in GDM and LGA babies. LGA babies. Okay, where there is LGA. Plan of care must be documented in care notes, agreed with the patient, including adequate pain relief, presence of senior staff to perform maneuvers. Okay, so that you had mentioned. So overall, a clear task. Nothing means these are debriefing kind of task, which one will able to very easily do it. Okay. So any question? No. Okay, Dr. Divya is there.